Hello, good morning, everybody, and welcome to this webinar. This event is actually part of our activities of Social Work Month, as we've called it. And I would like to give you a very warm welcome to all of you. During this month, we've done a number of activities, and one of them has been to link up with our sister organization in the US, the American Public Human Services Association, to jointly produce a series of articles on the vital role that social services and social work professionals play in social services. The first of this one was launched on Social Work Day, and a second one will be launched with specific examples of the work that our members in Europe and the US do. If we can move on to the next slide, please. We've worked on social services for many years through a dedicated research project and a seminar, through a series of sessions on the workforce, presented at many of our events, like the European Social Services Conference, to which I will refer later on. And we thought of this event, this webinar, where we are trying to explore the role of the principal social worker. This webinar came actually as a request of one of our members to precisely understand a little bit better whether this figure existed in all the countries, what were the permutations, what is the legal basis, and what is the practice around the figure itself. And this is why we brought together this webinar, where we've got with us, as you can see on the screen, we're going to be listening to examples of colleagues in social work from our member organizations in England, Ireland, and Austria, to reflect on social work within social services, leadership and practice improvement, as well as responsibilities in relation to the role of the principal social worker. So we've got with us three excellent speakers. Sarah Range is principal social worker in Southend in England, and she will tell us about the role and the added value that it brings to the practice of social work. Also, the perspectives of other principal social workers from local authorities in the area and how they fulfill their role. Maria McKenna is a service improvement manager with TUSLA, which is the Child and Family Agency in Ireland. And Maria will discuss how TUSLA's Chief Social Work Office engages with principal social workers, who of course play a key role in overseeing child protection services. And our third speaker will be Julia Pollack, who is the international representative for the National Association of Social Workers in Austria. Julia will discuss a series of roles in Austria's social services, which are similar to the role of the principal social worker. And she will also draw from her experience in a similar role in professional leadership in youth and community social work. Just a couple of practical considerations as well. I would like to remind you that you've got subtitles available on the right-hand side of your screen, and that you can also send your questions for our speakers through the chat and the Q&A session. We hope that the presentations and the follow-up conversations will help you to have a better understanding of the key considerations of having a principal social worker in social services organizations, and also reflections for countries where this figure might not currently be in place, but possibly would like to implement in the future. So we also hope for a fruitful discussion afterwards. So if we move on, just very briefly, I would like to give you in the next slide a very brief introduction to some of the work that we've done. Next slide, please. So we've worked, as I said, in the area of the social services workforce for a number of years. We conducted a research where we tried to identify the different compositions of social services teams across different countries based on legislation, policy, and practice. And also, we have addressed the issue of the workforce across a number of activities. One of them certainly being the conference, the European Social Services Conference, but also the European Social Services Awards that we launched in the year 2019. As I explained earlier on, members have expressed an interest in the figure of the principal social worker. They wanted to know more about a role that leads staff knowledge and competence in legislation. What is the legal basis for such a figure? Provides advice, inspires and leads the workforce, and also, very important, determine priorities for quality assurance and for delivery improvement. And this is also linked to the work that we are doing at European and national level, promoting quality assurance principles and frameworks within within different countries and at European level. Of course, we will see, and we were discussing this earlier on, there are plenty of differences in legislation across countries, but there are very similar functions, and this is what we will see in the presentations today. So moving on onto the next slide. We are now going to give the floor to Sarah, who is a head of quality practice and principal social worker in Southend in England. Sarah, the floor is yours.
Good morning, all. Thank you very much to the European Social Network for giving me the opportunity to speak. If I could have the first slide, please. So I'm speaking to you today as part of a partnership. My colleague Amanda is not able to join us today, but is very much here in spirit. And I'm fortunate enough to speak to you as one of 150 principal social workers across the 150 local authorities within England. We will go through in detail how our role is situated within a local authority, and I'll give you some context around the concept of how we're seated within legislation and how our role works to add value across our services. So the next slide, please. So our role as principal social workers is enshrined in law. So our primary legislation within adult social care across the UK is the Care Act 2014. And the principal social work role is very firmly seated as a key responsibility within that Care Act legislation. Every local authority in the UK is expected to employ someone to sit within the principal social work role that has the knowledge and experience across a wide spectrum of social care network elements. So our particular piece of work, our particular role is enshrined in the Care Act. So we have a responsibility to be the ambassadors for quality practice in our local authorities. So we have a responsibility to lead and oversee excellent social work practice. We have to have a strong commitment to support and develop the arrangements for our staff around excellent practice. We're seen to be the leaders to develop excellent social workers, and we support effective social work supervision and decision making. So there are three key tenets to our role. Our three key tenets are to oversee the quality, assurance, and improvement of social work practice, to make sure that the people that we serve receive quality intervention from competent members of staff who are clearly delivering against the tenets and values of the social work profession. We have a key responsibility to advise our senior management to help them understand what operationally is happening, to feed into the wider local authority structure, so the government structure, and to give advice and support around complex and controversial cases and situations, and be the leader in identifying and horizon scanning for developing case law or other law that relates to social work practice. We have a responsibility to function at the highest level of social work. So we will be working in the strategic space, focusing on the professional capabilities framework, which sits across the social work profession and is tied and linked to our registration status as qualified social workers. So we have a strong responsibility within each of our organizations to be performing at the very top level in terms of social work practice, but to be able to engage with our operational colleagues and work across the strata in our organizations to influence strategic policy and development so that we ensure that social work is a holistic tool in which to support people in their lives. Next slide, please. So what's one of the really key functions of the principal social work role? One of the key functions of the role is safeguarding. So we have a responsibility to make sure that we have a wide variety of knowledge, that we have a very strong legal literacy, and that we develop policies, procedures, and practice guidelines to support our staff in ensuring that we're delivering safeguarding in the most person-centered, autonomous, and self-directed way. We have a responsibility to ensure that the quality and consistency of our social work practice is fulfilling our statutory responsibilities. So within the CARE Act, as our primary legislation, there is strong guidance and legislative stature that we need to ensure that we fulfill. And as principal social workers, we have the chief responsibility to make sure that all of our social work staff work strongly within that legislation and support people who are experiencing or at risk of experiencing abuse or harm. We have a responsibility to have that extensive knowledge, as I've mentioned, being able to apply that into practice, but also being able to fulfill our responsibilities in a legal context. So the principal social work role is absolutely key in overseeing quality safeguarding interventions, supporting complex casework, and ensuring that practitioners have the tools and competencies they need so that the person ultimately has the most positive experience when they're in the most time of crisis. Next slide, please. Okay, so what are our main responsibilities for our role? So principal social workers across the UK have a responsibility to really be the strong leaders and the champions of social work practice. We have a responsibility to inspire and lead our social care workforce. So we operate, as I mentioned, in that strategic space. We operate with innovation and creativity to encourage our social workers and our other allied professionals to meet the needs of the residents and the communities that we are privileged to serve. We have a responsibility for strategic oversight. So we take the operational voice of practitioners along with what we need to deliver as a government body and ensure that we have strategic oversight of the social work practice. So we have a responsibility for leading on governance frameworks and working alongside our strategic partners to make sure that social care practice is effective, efficient, and fulfills its statutory functions and delivers with positive outcomes. So we have a real responsibility to make a difference in people's lives using our sphere of influence. So our influence extends to giving professional advice to our practitioners, supporting and working alongside our colleagues on complex interventions, and being that voice of the journey of the individual. So ensuring that from the time that someone approaches our services, they get the right service at the right time from practitioners who know what they're doing, who can deliver a good quality outcome to help people have better lives. We also have a key responsibility as a public body to ensure that we function within the sphere of financial responsibility. And we then have the responsibility, as I mentioned, for that safeguarding function. So we have a very clear mandate around quality assurance, safeguarding, legal literacy, and competent social work practice. So those are the main responsibilities of the role of a principal social worker. So very much to drive quality practice, to be the voice of the practitioners, and to also advocate within strategic space to really ensure that we are doing everything we can to deliver quality interventions for people at a time of crisis. Next slide, please. So why is the principal social work role unique? So besides being legislated and enshrined within the CARE Act, it is a unique role. There is usually one principal social worker per local authority area, which means that there are synergies across 150 different local authorities with people operating in that same space to deliver quality, high-end, strategic oversight of safeguarding and quality assurance social work practice. So as the principal social worker, our role means that we are ambassadors. We have responsibilities for delivering services within an ethical framework. We have a responsibility for ensuring that our staff work within the space of understanding trauma-informed practice using the lens of strength-based approach. We have a responsibility to ensure that all of our outcomes are person-centered, that people are connected to their communities, and that we ensure that there is value for money for our taxpayers. So we encourage ingenuity, and we are the voice of social work. And we have to understand what our practitioners are telling us and advocate for good quality outcomes. We create that space by having courageous conversations to encourage courageous practice, to develop those best interventions. We champion excellent social work practice within our local authorities, and we contribute to the development of a regional and a national perspective. So above the role of the principal social worker in each local authority, we belong to a national network where we come together several times a year to talk about practice developments and learning. And then we are represented by a chief social worker who speaks for and represents the social workers of all 150 local authorities at government level. So our chief social worker is Lynn Romeo. We take a lead in supporting our staff to understand they have robust knowledge and competence, and that they can apply in a skillful way the legislation. We run that fine balance between professional judgment on an individual level whilst advocating within the macro level of government. So we have a responsibility for having excellent negotiation skills and supporting our staff to develop strong partnerships. So that's some of the reasons why the principal social work role is unique. Next slide, please. So in preparing for this presentation, within our Eastern region, we have 12 other principal social workers, and we did a bit of a temperature check, really, and asked them some key questions in their own words as to what they bring to the table as principal social workers. So I'm going to share with you some feedback from our colleagues in Suffolk and one of our colleagues in Essex County Council. So we asked the key question: what led you to become a principal social worker? So our colleague in Suffolk has said that she wanted to work in an environment which was influenced by best practice over the entirety of the organisation. It was an honour to hold the principal social work role through the pandemic, developing practice, considering easements and the best use of the ethical framework. So that just gives you a view for Fiona, what it was like to work as a principal social worker at a key time in a national crisis. Our colleague Alison has shared with us that she's been a registered social worker for 25 years. Excuse me. And being a principal social worker was never planned, but the opportunity to cover the role arose and she grasped it with both hands. So you'll see really clearly from our colleagues that it's very much an honour and a privilege for all of us to work in this space as principal social workers, and not a responsibility that we take lightly. Next slide. The next key question we asked is, what's your biggest challenge? So one of our colleagues told us ensuring that social work continues to be seen as a pivotal and relational and agent of change in a landscape of performance, budget management, and wider challenges. Our other colleague shared with us that the greatest challenge of being a principal social worker is inconsistency in team structures and practice associated with the ways that the county in which she works in has moved to 3 different areas aligned with her key partner within the health service. So she goes on to elaborate a bit further about some of the challenges within working in partnership. So within the principal social work role, negotiation and partnership working is one of the core skills that we have responsibilities for navigating. Next slide, please. Excuse me. So we asked the really key question: what's the best part of being a principal social worker? One of our colleagues has told us it's having the privilege to work alongside and learn from the wider social work community, whilst ensuring this practice forms a central part of what we do within adult social care. Another colleague shared, it's the ability to influence change and the best social work practice within social services. Engaging with a wider network enables best practice to be shared and learned from, ensuring that our local community is part of the wider network. Strength-based practice compliance, and increasing resources and relationships. So those are some of the absolute takeaway benefits that we, acting within the principal social work role, take away from our day-to-day work. Next slide, please. So as I conclude, you'll see that the principal social work role, though enshrined in law, is also fundamentally important in role to the ethics, values, and the tenets of our practice within social work. And the principal social work role allows local authorities to exercise in the space from an operational perspective to influence strategic delivery of the local authority and government objectives. So with thanks to my colleagues, thank you very much.
Thank you very much, Sarah, for introducing the figure of the principal social worker in England, and specifically in the region where Southend is located. I was wondering, as potential questions may come in, whether I can ask you a question, just so that we get an understanding. You referred to some of the numbers in relation to how many principal social workers are there. So what are the requirements, or what are the criteria, rather than the requirements? What are the criteria to have a principal social worker in, let's say, in an area? So what are we looking at? Are we looking at population? Are we looking at needs? Are we looking at the initiative of the local authorities and the social services teams?
Mm-hmm.
I mean, how is that? Where do we get the criteria in terms of how we say we have to have a principal social worker? And then who is that is going to be working, who are they going to be working with? Are they going to be working with a set of local authorities, teams? So if you can get us a sense of how that works.
Okay, so within the UK, the local authorities are strategically set. So each geographic area will fit into what's called a local authority, which is the government body which governs the local policy and procedure of that particular area. And within each of those geographic regions, there will be a Department of Social Services as statutory. So the CARE Act has instructed that every local authority which receives government funding from central government will have a principal social worker. So that's how that decision is made. So it comes online with your constitution as a local authority, and then the CARE Act is then applicable to you as one of the many duties as a registered local government authority. So in terms of the criteria, so each local authority will usually have an adult principal social worker as well as a children's principal social worker. In some local authorities, there's one person that straddles the adults and children's business, but in the main, one each. So in theory, there's many more than 150 principal social workers in the country. In terms of region, there are groupings of local authorities. So I represent the Eastern region, and I chair the network for 12 local authorities within our region, as well as some mental health trusts. So that will bring together all the principal social workers in those organizations, so that we can shape and influence practice in our geographic region. And then above that, we will have a national network. So each of our principal social workers, each of us have a seat around a table within a national network where we share good practice and competencies and skills and development opportunities. And then above us, there is Lynn Romeo, who is the chief social worker, and her job is to directly influence government policy and direction within the Department of Health and Social Care, which is one of the government ministry offices within the UK. So I hope that explains from a micro level to a macrocosmic practice level the role of principal social work.
It does indeed. Actually, we've got also a question from Martins, who is director in Latvia, and he was asking about in Riga City Council, and he was asking about how this figure fits within the system. So are in relation to managers? Now he was asking
Yes.
about what is then the
Okay.
relationship with managers. Are they advisors, consultants, or are you an advisor or a consultant, or rather a quality controller?
Okay, so the principal social work role primarily is somebody of senior stature within the organization. So you, in most local authorities, you form part of the senior management team. So you are representing the voice of social work at that very strategic operational level. In terms of the role of the principal social worker, you will be responsible for the quality assurance and the practice delivery, as well as the safeguarding elements across the entire sphere of your adult social care. So working with people with sensory or learning disabilities, physical disabilities, older age adults, people with mental health, substance misuse issues. So you will represent and sit across the top layer of all of those services and all of those teams. So you will be the identified kind of figurehead in terms of that leadership element, but you will be able to go very much into that operational space if you need to. But you will be advising, supporting, working alongside, not technically directly managing interventions, because you will be performing at that strata level above that direct operational responsibility. So I hope that explains that space. Very senior management responsibility that hasn't lost the ability to connect in a very operational way, to make sure that you don't have that disconnect between what happens on the ground and what is being managed at a government level.
Excellent. Thank you so much, Sarah. He echoes Maria's words about great and really interesting presentation, and how also this figure is actually established within the legislation. And now we move onto Ireland to actually, Maria, for you to tell us how does the figure work there in Ireland?
Thank you. Good morning, everybody. My name is Maria McInnes. I'm a Service Improvement Manager with TUSLA, the Child and Family Agency in the Republic of Ireland. And I just want to compliment Sarah on her presentation, and it's already very interesting to see the differences in two neighbouring jurisdictions in terms of the approach taken with the work of the principal social worker. So it was really interesting. So if you can start my slideshow, please. So TUSLA. TUSLA is the National Child and Family Agency in Ireland. It's a new agency. It was formed in 2014. If you want to go to the next slide, please. It transformed the delivery, it has transformed the delivery of child protection and welfare services in Ireland. Prior to 2014, child protection work was part of the work of the health service, and it was divided up across the country into about 10 different regions. So it transformed us from a strategic point of view in that we are a dedicated state agency responsible for improving the well-being and outcomes for children. It is extensive in terms of the reform it brought to the bringing together of child protection, early intervention and family support services in Ireland. The name TUSLA. TUSLA borrows from Irish words, from Gaelic. The first word is tus, second word is la. Tus means the start, la means the day. So it reflected this shared desire for a new beginning, a new identity, a new way of working together. Next slide, please. So it brought together child protection and welfare services, and child protection and welfare services do make up a significant part of the work that we do. Education and welfare services, psychological services, alternative care services, family and locally based community support services, early years regulations for preschool and kindergarten services, and then our domestic, sexual and gender-based violence services. I just noticed somebody asked, can they hear me? Is everybody hearing me okay? Just take a sound check. Yeah, thank you. Okay, next slide, please. So what did this new way of working mean? It means that we very much were trying to move from a very risk-based child protection system to a more safety-oriented child protection system. So moving from a risk-based child protection system means moving away from procedure, from risk management, from an approach to child protection that is much more heavily invested in the relationship between the practitioner and the family. So TUSLA, in making that shift, also in terms of our assessment frameworks and the way we worked with families, we had a multitude of assessment frameworks that we were using. We weren't using any one single approach. And I think there was a general consensus that we wanted to be doing things the same from the bottom of our country in Cork up to the top of our country in Donegal, that the way that we work with families should be the same regardless of where we were in the country. So we reviewed a large number of assessment frameworks, and we decided to go with the Signs of Safety as our practice approach model. Signs of Safety was selected primarily because it is a strengths-based, safety-oriented system that's very much about working in participation with families. It's built on the notion of future safety. It's future-focused. It's about engaging the family and their wider network in developing and co-creating the plans in safety for the child. And that was very much the spirit upon which we wanted to build our practice approach into the future with our families in Ireland. So I work within the Chief Social Worker's Office. And unlike the UK, it's not enshrined in legislation. It's a new office that was developed in recent years, probably in 2017, about the same time that we brought in the Signs of Safety approach. And I think we have been given a little bit more leg room in terms of determining what it is that our Chief Social Worker's Office is all about. So we are bringing our strategic vision into reality as we speak every day. But I think in essence, to really, it's about encouraging, supporting and facilitating reflective practice always. And it's about staying in that learning space all the time and recognizing that all of us every day are on a learning journey, and that we must be open to learning, because one of the biggest challenges for us in the work that we do is that change is with us every day. Change is constant. So we have to stay in that space of learning every day in order to enable and get stronger and to grow. Next slide, please. So where does the principal social worker fit in the Irish context? There have always been a social work grade, our principal social worker grade in our spine of governance. In our frontline practice in child protection and welfare work, we have our social workers and our social care workers, which is a grade I think that's unique to Ireland. And in their work with families, they're typically in a team of 6 to 8 social workers who are then managed by a team leader, who then in turn is managed by a principal social worker. And the principal social worker is the most senior level of practice management in the areas, the TUSLA areas in Ireland. There are 17 TUSLA areas, and each of those 17 areas would typically have between, depending on size, about 4 to 6 principal social workers. And those principal social workers are leading and managing practice in their service areas. They tend to be identified with particular areas of practice. So it's either frontline or intake services, longer term work with families, alternative care services, or children and fostering services. They are in turn managed by area managers and right up the chain of command then to the Chief Executive Officer for TUSLA. But in terms of managing any system, they have a range of duties. They have, staff management issues, they have financial management issues, they have all that comes with the management of a service on a daily basis. So we really want to bring attention to their role as practice managers and to really support and encourage and facilitate them in leading practice in their sphere of influence. And how do we help them make practice visible? And then how do we understand where the governance of practice begins and ends? So these are conversations that we still have and are having in terms of how we encourage and support the most effective way of ensuring that leadership that Sarah spoke about earlier in that role in everyday practice in the teams that they manage. Next slide, please. So The role of the Chief Social Worker's Office is certainly important in that context. And we see ourselves as bringing together the learning, both from the external influencers and from the internal. So externally, even in recent years, all of us will have had the joy of really coming to grips with, saying, data protection is an issue. What's that? What's the impact of data protection on our practice? Well, social work is a profession that records an awful lot. And we have to really understand even that principle of data minimization. What does that mean for us in our practice writing, in our recording, and what we do? So we're always thinking about how do we bring these external influences into our practice learning. In Ireland, we have HECO, which is our external inspection body. We also have all of our internal processes in terms of our audits, our case reviews, all of those things that help us learn every day. So our work in the Chief Social Worker's Office, as it's developing, is about learning, identifying. We want to work from an appreciative point of view. We want to learn from what's working well. Social work and child protection is a heavily deficit-oriented service. We know very well what we're not doing well, because if we don't tell ourselves, somebody else will tell us very quickly what it is that we're not doing well. So we need to stake a claim for what it is that we are doing well, build on that, build it and make it stronger. In exactly the same way as we're working with our families. We are working with our families to make them stronger, to shine a light on the things that they are doing well, and to grow from that place of appreciation. So we want to model that perspective at every level in the work that we do, in this human relationship work that we do with our families, and in this human relationship work that we do with each other. We want to support practice from the point of entry. Child protection work is an area of work that we all know has a huge problem with retention. It's a really difficult area to work in. We want, and often we get at entry level in our child protection systems, very newly qualified people. And we want to really support and encourage them. We want to help them learn on the job, stay challenged to learn, but also feel incredibly supported in the work that they do. We want to develop a very interactive way in engaging them in the learning around evidence, so that they can build their professional knowledge base on the job in an easy to learn way. And then we want to improve our practice and build, and we've built a national ICT infrastructure supporting the childcare information that we have to record in relation to families we work in. We want that to be built from a practice perspective. A lot of people say, why have we got the National Childcare Information System in the Chief Social Worker's Office? Well, there's a reason for that. The reason is that our childcare information system need to be built on practice. They need to be built from the experience of the practitioner. They need to have an intuitive development that actually for every social worker on the ground, because we're all moving to, if we haven't moved there yet, we all generally are moving to an ICT infrastructure. So how do you grow that in a way that's in tune with the practice of social work? If you have the next slide, please. So what are we doing right now in the Chief Social Worker's Office to help learn, support and improve practice? Well, one of the first big tasks that we've had over the last few years is actually creating a learning system, because we have 17 areas. 17 areas who do things in their own way, and some of them have very good approaches to learning, but we need to bring consistency across the country. So we've had to start from scratch and process, map and develop a learning system that works from the ground up. And we've tested that and we've co-created that with the practitioners and our quality assurance system, so that it's a collaborative thing and it's about learning together. The second thing that we're trying to pay a lot of attention to is, how do we notice good practice? How do we build, we're all familiar with the concept of risk registers. Well, how do we build a register of good practice so that people can easily read and appreciate and understand what good looks like? And in doing that, we've had to first really think about, what are the characteristics of good practice? What is good practice made up of? So we have really done the thinking and the researching into terms of developing, first of all, a picture of what good practice looks like. And then we have tested it out in terms of looking at where do we notice good practice? We've developed compliments and complaints registers, and we're finding that actually looking at our compliments register is a very good place to start, but there are lots of ways to start to look at good practice. So we're really beginning to dig into and create systems for noticing, capturing, and really getting our senior managers, and our principal social workers are so important as leaders in our areas around this, in terms of shining a light on what good looks like, and growing it and nourishing it and developing it and then showcasing it. We really have worked, again, in the last couple of years, we've developed a program around the practice development and infrastructural support that's needed to help entry-level social workers. To help entry-level social workers, we need to help the team leaders, because the team leaders often in that frontline practice are working hand in glove, working alongside people. They're often quite new into their roles as well, and we need to mentor them, we need to support them. So we're developing a mentoring system that also encourages senior leaders in the organization to engage with practice. Over the course of the last 2 years with COVID, and in Ireland, we had the joy of a cyber attack in May, June time. I had the pleasure of being a frontline practitioner in that space and going and taking the calls, working every day alongside practitioners in that space, and actually remembering and reflecting with them what you do is important. What you do is the backbone of the work. What happens in corporate TUSLA is not important. You are the important part of the work. So it's always about encouraging and supporting as a leader in the agency, that practice is always where we need to be. As part of that, we need to help them in their busy working lives to have easy access to evidence. We don't have time for reading up journals. They don't have time for all of the academic reading that we would like them in theory to be able to do. So we have tried to create systems and learning portals that provide evidence in a very easy to read way, that connects particularly to the question they have around their evidence that they want to include in their assessments, and particularly for court and places like that, to be able to fluidly and easily use evidence to support their assessments when they present them to court. Our most new project that we're growing is around integrated service management and service improvement. We're coming from a very fragmented system of service improvement. It's reactive. Whatever the last inspection was, that's the service improvement plan for the area. Whatever the last external report that has lots to say in terms of what needs to happen next. Well, instead of having a reactive service improvement system, we're trying to build a proactive one where we actually shine a light on ourselves. We look at ourselves, and we're growing that from the ground up. And that we captured and analyzed a lot of the learning from external reports recently, and we thought about that from each grade of the service. So what does this mean for me as a social worker? What do I need to think about? And what do I need to think about as a team leader? What do I need to think about as a practice, as a principal social worker? And then we're hoping to test that in terms of a self-assessment tool that'll be built into our service improvement and built into then a participative service improvement with our families that we work with. So that's very early days of testing. But I think the main way that we want to do our work in the Chief Social Worker's Office is hand in hand with practice, and our principal social workers are a key grade for us. So as part of that, we're building our learning communities to ensure that even at regional levels, that we're bringing our principal social workers together in communities of practice, which sounds very similar to what Sarah's described in terms of what she's doing in the local authority areas, but it's actually to use them and their knowledge and their experience of what's on the ground in terms of driving improvement, and also for them to feel that they are the leading lights in the improvement systems that we build. And then I suppose we're always looking outwards in terms of learning. We're a small island nation. We like to take our learning from wherever we can find it. Our most recently, we're developing and implementing the Barnahus across the country, and we're very proud of where we have that implemented. And for those that aren't familiar with Barnahus, it is that multidisciplinary approach to the management of sexual abuse. So that's where we're at in terms of our growing focus on practice development and principal social workers in Ireland. I hope that's been useful.
Thank you very much, Maria. Very useful indeed. Thanks a lot for taking us through the work that you do within the Chief Social Workers Office and the work of the principal social workers. You were saying that it's not established within the legislation. Therefore, I was wondering then how does it work then? So if it's not established in the legislation, is it embedded within practice? Is it how does that work?
Okay, so I think the principal social worker grade has been in existence for a very long time here. It's a management grade. It may reflect a senior management grade in other jurisdictions. So it's part of the governance structure. I think what we're trying to do is work in that relationship space, really, in terms of working with the principal social workers to really refocus and help them grow as leaders of practice, as opposed to being general management leaders. Because I think in our proceduralized systems, it's very easy to lose the focus on practice and spread your management focus to a whole range of different things. So we're gradually bringing them back on their ultimate focus, which is on the delivery of quality practice at the front line.
Excellent. Thank you very much for that clarification, Maria. I will now turn to Julia. After listening to Sarah and Maria, Julia, tell us about the situation with this figure and the equivalence in Austria's social work and social services.
First of all, I would like to thank Maria. It was very inspiring for me to hear how the frontline social workers are seen in your organization and in Ireland as key to the quality of social work and social sciences services. And yeah, thank you for inviting me to speak here today. You see my name on a slide. In the past, I have worked as a frontline social worker as well as in leading positions in Austria, and I did also some research on social work. And today I'm here to give you some insights of how professional law and professionalization of social work contribute to establishing formal positions like the one of principal social workers, which we heard from Sarah and Maria. And as a precondition, please keep in mind that I'm speaking about Austria, and in Austria there is no professional law that defines the profession of social work, and there is no formal accreditation, and there is no governmental body that monitors quality in all fields of social services and social work. So I'm speaking from a different point of view here. Next slide, please. Next one. Yeah, so I will start with a very short history of the social work profession in Austria and give you some insights on that. As you see, professional education in social work and social pedagogics started in the 1920s on secondary school levels. And from that time on, frontline social workers and social pedagogues were educated on that secondary school level. And the head of departments and head of services, especially in governmental social services, have always been members of other professions. Next slide, please. And then there came a big change around the year 2000, where studies in social work have been put on University of Applied Science level. And since then, you can do studies in social work on a bachelor and or master level. And while studies on bachelor level educate mainly for working directly with service users, master studies aim either to a further specialization in the field of social work, or they are preparing for leading positions. And at the time of the implementation of master studies, like I put on the slide, like social management, social innovation, social transformation, this was seen as a mean to qualify frontline social workers and to give them the possibility to reach leading positions. And it was and is still seen as a means to include the knowledge of the profession and strengthen the position of social work in Austria. But the situation today about the formal qualifications, next slide, please. Right now, it's still like that, but many persons in leading positions in governmental social services are still of other professions, and therefore the voice of social work and its expertise was and is not always heard. And in the same time, the private or NGO sector expanded, and within this sector, less formal requirements apply for leading positions, and so there tend to be more social workers or persons having experience in social work in that positions. Next slide, please. So yeah, who acts as a principal social worker in Austria? It's a broad variety of persons, in fact, that is pioneers of social work, as well as skilled and experienced social workers, or persons having master's degrees and having studied social management or social innovation. But there are still many persons holding leading positions, especially in the public social service sector, who don't have any qualification or experience in the field of social work as such. But due to retirements, this is changing, but it's changing slowly. Next slide, please. So I was wondering, in preparation to this input, may those colleagues be called principal social workers in those leading positions? And yes or no? And as you could see, I put some arguments together, and I'm not able to make a final decision on that. And I think this is because in the case with social work in Austria, professionalization is still underway, and professionalization happened extremely fast in some contexts of education. And in the same time, professionalization is very slow, or even not happening at all when it comes to establishing a professional law or to quality standards. So next slide, please. Here I just put together some German words for persons in positions who could fulfill the role of a principal social worker. And as you see, it's a long list, and it's up to organizations and social service departments which occupation you write on door plates and in email signatures. And most of them is Leitung, that means it's a leading position or leadership. Next slide, please. So this is, last but not least, yeah, I would like to share some thoughts what, to my opinion, is crucial for fulfilling the job as a principal social worker, and just for doing the job and fulfilling the requirements and contributing to the quality of social work, whether it is formally recognized or not as being a principal social worker. And for me, having worked as a frontline social worker, as well as being in a leading position, the most important thing is to listen closely. And all your plannings, preparations, checkings, actions shall derive from listening. And from listening, I mean listening on micro, meso, and macro level, as I pointed out on the slide, and because that means listening to the voices of service users and the society, as well as to the voices of the individual social worker, the team, and also the professional community. And I think this is the main spirit of a principal social worker, or being in a leading position and still being a social worker in my heart. But I always keep in mind what's my profession, what's my professional knowledge, and everything has to derive from that. So while listening, planning, doing, checking, acting, you have always keep in mind the triple mandate of a social work profession. And this triple mandate is, and the professional ethics, they are key to the quality of social work as such. And I think this is one of the most important things everybody being in leading position in social work should be able to do. yeah. So I think my contribution was now a little bit shorter than the other ones, and but I would be glad to answer some questions or give my word back to Alfonso.
Thank you very much, Julia, for taking us through the different trainings and roles that exist within the social services system and social work in Austria. And you actually, there was the screen earlier on, you showed some of the positions that could take on the role of a social worker, and I was wondering, of the principal social worker, and I was wondering whether, having listened to a couple of experiences from other countries, whether you feel that within those positions, let's say the roles and responsibilities of the principal social worker are covered, or whether you actually feel that Austria, in these developments that you have referred to and how this is evolving, would also benefit from having also an actual figure of a principal social worker established with our recent legislation or policy and practice.
I think what Austria needs most is a professional law of social work as such, and within that law, key positions could be written down, or it would be possible to make. If it's about quality has been said also in legislation. And I think if there would be a law, a professional law that sets standards in qualification and quality, and also maybe in the range of how many persons have to do the job, so in the ratio of service users to professionals, many things would go on from there, and it would be, I think it would be a no-brainer that principal social workers would be needed then. But right now, many of those thoughts are made only by management and vegetarian decisions, and it's cutting in the budgets all over in social services, or it had been during the last 20 years, in fact. And I think this is where the situation we are in Austria right now is coming from.
Mm-hmm. Okay. Thank you, Julia, for these reflections, the situation in Austria as well, and some of the potential changes that could take place to actually move forward and some of the professionalization of the sector. You still have some time to send some questions. If we move briefly we have around 5 to 10 minutes discussion. If we can move on to the next couple of slides onto our conversation. Voila, so we've got the interactive discussion now going on. If you still want to send any questions through the Q&A or chat, there was a question sent through the chat. I think it was to Mary around the example of how access to evidence can be implemented, and Mary replied to some of the information there in relation to the program that TUSLA has in place, the evidence-informed practice program that you've got in place, and the EPPI toolkit as well. I don't know, Mary, if you wanted to highlight any in relation to this.
Yeah, I would need to share my screen to really, I suppose that it's about the ease of access is really the issue here in terms of social workers being able to easily access that evidence. So what we've done is we have a national a website, an internal website for TUSLA, and on that website we have an icon, you know, that you can push on, and it brings you to the evidence-informed practitioners program. And in that, then there are a series of toolkits, and then you click on the toolkit that you're interested in, and it brings you into articles, and then it brings, you know, you can click onto icons and it'll bring you to videos that'll better describe what it is. I sent an example through, I don't know if you can share it, in terms of one around attachment. So it's just really about taking evidence and presenting it in a very easy to read format, when people who are hard pressed for time can actually spend a few minutes reading and learning as they're going, really. So that's the it's through an internal TUSLA website.
Thank you very much, Maria. I was wondering if maybe I can ask you a question to the three of you. In relation to the theme and to the position, what would you say are the key considerations of introducing the figure of a principal social worker, let's say in a country, in an area where it doesn't exist? I may ask maybe first Sarah to start.
Having worked in the US, where the principal social work role didn't exist in 20 years ago when I practiced there, I guess one of the considerations that I'd be thinking about is what is the added value? What difference would having that role actually make to the individual person? Because I think unless you can tie the benefits down to that individual person service user level, then the kind of motivation for doing the role for me is questionable. Because if it's about saving money, if it's about efficiencies, what have you, that gets you further and further away from the ethos of quality social work intervention. So I think for me, if it starts at the heart of what is in the best interest of the people you serve, then you're not going to go very far wrong, because that's, you know, you're in a strong footing and foundation, really. So I guess prior to the Care Act here in the UK, the role of principal social work didn't exist. So prior to 2014, really, it didn't have the oomph and the strength. Like Julie is saying, it wasn't legislated. I think once you protect the title of social work, make it an offence to call yourself a social worker and not be a registered social worker, you know, the principal social work role very much was supported and really bolstered by that Care Act legislation, which covers the elements around that offence nature in terms of the role of social work. So it adds even more footing and gravitas to the role of our profession, and sees it on equal footing as a nurse or a doctor or other professions within the human services.
Thank you very much for this. Because actually you mentioned earlier on, and also in the chat, you referred to having the social work also protected in legislation, whether there were other countries where that was the case. And I think this example that you have presented actually shows very clearly what you meant by that. I was wondering, Maria, what your views are.
Yeah, I was really interested when Julia was speaking about the fact that, you know, social work isn't a protected title in Austria. And I was thinking about in this country, what led to social work becoming a protected title. And there's no doubt about it, that whatever the type of light that's shone on the work, and unfortunately in the history of this country, it has been as a result of huge failures in our past systems that we had in this country a massive commission into the investigation of sexual abuse by the church. And I think that the good, if there can be good that comes from this, is that it shines a light on the work that we do. And it's like, we cannot ever let this happen again. What must we do? And that became a political conversation in the country. So in some ways, we have to start the conversation somewhere about shining a light on the work that we do. I'd rather that it came from good reasons rather than for what hasn't worked well. But I think part of it's about the value that's placed on the profession. And I think getting social work registered as a profession is a fundamental starting place. I would suggest is really important, because we need to, and also, you know, the medical models, and those models are so entrenched and understood in our societies. Our social care models are not as understood. So we need to start on conversations about the social determinants of health, about why what we do really matters, and the economic benefit of the work that we do. We have to talk a language that maybe doesn't come as naturally to us, but we have to start engaging in conversations fundamentally about the value of the work we do in terms of its place for all of society and for better outcomes for all of society. And then I think it begins to grow from that. I think, you know, in countries that don't have that, you need to develop your alliances with wherever the work comes together with other more developed systems. And you know, we had our alliances in health as well. We had people who understood the value of the social work and why it was important. And I think there needs to be alliances built and pressure put on, and rather than having to come at it from commissions of investigations, to try and come at it from that perspective may help shine a light on it.
Thank you.
I hope that's helpful.
Absolutely, yes. No, it's a very, very clear message, very much along the lines of what Sarah was saying in terms of registration, and also in relation to some of the comments that were made by Julia. But I was wondering, Julia, from your perspective, and also what you see as the key considerations, if you were to introduce a figure like this.
I didn't get the second part of your sentence.
If you were to introduce a figure like this, a principal social worker, what would be then the key considerations to take into account?
The key consideration would be that it should be established to enshrine quality, and as Sarah said before, to be based on the ethos of social work, and putting quality first, as you put it, as ESN, yeah, because doing just anything which is a little bit of social is not good enough for persons needing support and advice, and quality is needed. And social work is a profession, and social work can contribute to quality of social services as well as other professions, but there are examples where social work is the right profession with the right knowledge at the right place, and this has to be seen, I think, also in Austria.
Wonderful. Well, I think we are closing the time. I think I'm concerned with the timing, but very briefly, there was a question which maybe is important to mention. There was a question for Sarah, and then another one maybe more general. For Sarah was how many frontline practitioners are principal social workers responsible for? Maybe briefly mention that.
Yeah, it will vary based on the size and demographic
Exactly.
of your local authority. So within my local authority, at any one time, between 80 and 100 social workers and social work students, but some local authorities, 400, 500 social workers. So very much that strategic space.
Yeah.
The other question was around what operational responsibilities we have, and the principal social work role most likely in local authorities doesn't have the luxury of that being the sole focus and function of their responsibility. So many of us hold other responsibilities, such as being head of mental health, or head of autism, or head of other different groups of practice, as well as the principal social work role. Like I'm head of quality and the principal social worker. Hope that helps.
Absolutely, I think so. I think that with this we can maybe bring this to a close. Very briefly, I would like to refer to the importance of quality. I mean, quality has come so many times throughout the three presentations, and the importance and the key role of frontline social services professionals to make sure that social services are of quality. But I think something very important, which was mentioned as well, is the role of the principal social worker as the responsible person to encourage and to facilitate these conversations, these discussions, this around quality improvement. And there, I think some of you mentioned the word advocate, so the advocacy as well within this strategic space to deliver interventions which are of quality within social services. There are differences between countries when it comes to legislations, as we have seen, but certainly what we saw as well is very insightful presentations around the role of the principal social workers being key when it comes to delivering quality services. So I think it's something to take into account when it comes to the different international experience we've listened to today, and certainly something we as ESN would like to put forward. I'd like to thank you all. Maybe very briefly just remind you of a couple of things. We've got the European Social Services Conference coming up in the next month of June, and one of the areas we're going to be looking at is actually the promotion of resilience social services through the workforce. So the workforce will be very much front stage, if I might put it that way. It'll be at the stage when it comes to the plenaries. We've got plenty of workshops on those. We've got a specific parallel discussion on the role of the workforce and how the workforce take the central role when it comes to promoting resilient and robust social services. So we think it will be a fantastic opportunity for colleagues who are responsible for social services, social work across Europe to attend, and we hope to see you there. Also, maybe just very briefly, we try to celebrate social services as well, and the awards, the European Social Services Awards, which actually the focus was on building resilience. The ceremony for 2021, which couldn't take place at the end of November, will be taking place on the 1st of April in Brussels. And one of the categories is the outstanding team. So precisely, again, to celebrate the idea of social services professionals, alliances, Maria mentioned earlier on, alliances, social workers working with different colleagues within the social services teams, but also across other public services to deliver collaborative practices and to deliver quality interventions. And the outstanding team collaborative practices are two of the categories, and we will announce the winners on the 1st of April. The ceremony is still open for those of you who wish to attend. And with this, I'd like to thank Sarah, Maria, Julia for being with us today for these very insightful presentations, which I think have really shown light on what is the situation when it comes to the principal social worker figure across different countries. I do hope that our members at ESM would have got a better understanding, and certainly we can continue with the discussion. We offer the possibility to have peer learning programs, which could be a great opportunity to actually find out more about the figure of the principal social worker. Thank you so much to all of you who worked there with us. We had almost 67 participants as well at a certain time. So thanks a lot for being with us. Have a lovely day.